The event was organized to appreciate healthcare personnel who worked around the clock to test and diagnose samples that were collected from cases and probable cases of Ebola and COVID-19.
Thank you, God, for these families, the staff and their families.
For any epidemic, you need to know. You can bleed with the Ebola signs, but it might be Ebola or not. So our role as lab, what are you suffering from?
People from developed countries come here to learn from Uganda how we managed very well COVID, and we lost the least, I think, on the globe.
For the Ebola outbreak in September last year, Dr Atwine says that the laboratory services took an unprecedented step of setting up a mobile laboratory in Mubende district.
We did the tests in Mubende. We established something that has never happened ever. We were the first country ever in the world to establish a mobile lab to handle serious pathogen like Ebola. And no single person got infected in that lab.
And we had already had trainings for our laboratory staff in Ebola training. We had been given 2 mobile labs by the East African community. So we were ready. It was about a matter of 2-3 days to deploy where the epidemic is.
This did not only help stop the spread of Ebola in 10 weeks, but it also lifted the status of the country's laboratory services. The Ministry of Health is cognizant of the fact that laboratory services are the heart of the country's response to any disease outbreak. Unfortunately, the low resource envelope provided for its services are a concern.
Other members of parliament don't know what we do. If they knew, they would advocate that we get money so that we don't depend on donors. Because we depend on donors largely.
In the meantime, plans to extend the country's public laboratory are ongoing.
This is a lab that quickly comes up to support and test for any emergency, be it Ebola, Marburg, cranium cholera, typhoid, meningitis. Yes. So we must have it ready and well equipped with competent people to immediately swing in.
Uganda has over 50 laboratories managed under the National Health Laboratory and Diagnostic Services. Joyce Nakato, NTV Weekend Edition.
Laboratory.